Hello, welcome to Hints for Health, a series of podcasts covering areas and issues of concern and interest to global workers and those interested in having optimum health. Join us as we explore topics that affect most of us today and find ways to address potential challenges to your health. So let's join our hosts, Brian and Stephanie Kidman.
Hello, I'm Stephanie Kidman, a registered nurse working with Compassion Link. Today we are going to talk about an all too common visitor in the lives of many people. What is that? Back pain. It has been estimated that about 80% of Americans will experience acute back pain, and 10% of them will develop chronic back pain. Let's talk to Dr. Brian Kidman about where this back pain comes from, how we can treat it, and finally, how we can prevent it from occurring, or in some cases, reoccurring. Dr. Kidman, I know that sometimes what we call back pain is really pain that comes from an organ or an organ system and refers pain to the back area, but it is not coming from the back structure itself.
Yes, and that type of back pain we would call non-structural or referred pain. And there are many causes of non-structural pain in the lower back area. Probably the most common causes would be kidney stones, but also endometriosis, pancreatitis, stomach or duodenal ulcers, even shingles. But today, let's focus on structural causes of back pain, where it originates from the back itself.
Could you tell us more about the structure so we can understand where pain might be stemming from?
Yes, certainly. So the spine and pelvis, which of course are connected, are full of ligaments and tendons, muscles that provide strength and a big variety of movement capabilities. Ligaments hold bones together, usually in a joint, and they provide a balance of stability and flexibility for movement of that joint. Tendons connect muscle to bone and enable movement of the joint. Now, running within these structures, these ligaments and tendons, are nerves, which are found in all connected tissues except for cartilage. When one of these structures is damaged from being stressed too much or stretched too far, the accompanying nerves may be damaged as well, which then leads to pain. Weakened and or scarred ligaments, tendons, muscles can be a source of chronic pain.
And where do these problems come from in the first place?
Structural causes can be inherited, such as scoliosis, or otherwise known as curvature of the spine, but most often, structural causes begin with an injury, such as from a fall, car accident, a fight, a sporting injury, maybe even improper lifting technique, even poor posture. So in such injuries, there can be damage to the joint or tears in a muscle, tendon, ligament, or even damage to a vertebral disc or even the vertebra backbone itself, which leads to the initial pain. And then if healing doesn't continue to completion, weakness and scarring develop in the injured structure, making it more prone to future re-injury and then ultimately chronic pain.
Chronic pain, not something any of us want to deal with. What treatments are available? What hope is available?
Well, healing injured structures in the back can be accomplished with a variety of treatments. But the most important part of healing is to provide the injured structures with the needed hydration, nutrition, activity, and rest, and of course, avoidance of repeated injuries. So beyond these basics, other treatments might include physical therapy, chiropractic care, regenerative treatments and injections, surgical options, medications, and others.
If a person has injured their back, how long should they take care of it at home before deciding to see a doctor for help with both diagnosis and treatment?
That's a good question, and it's a little bit dependent on the person, but generally speaking, since most injuries to the back are in the muscle, tendon, or ligament, those structures typically heal in about 4 to 6 weeks, but that's assuming appropriate hydration, nutrition, rest, and avoidance of re-injury. So if upon initial injury the pain is not controlled reasonably well with an over-the-counter pain reliever, then it might be time to call your doctor. At the 2 to 3 week mark, there should be substantial improvement, but if there's not, then it's appropriate to see your doctor. And if at the end of 6 weeks the pain is not either resolved or continuing to show steady improvement, then probably should give your doctor a call.
Okay, so if I injure my back and it's going to heal on its own, I should see good improvement in 2 to 3 weeks and marked improvement in 6. Let's talk about hydration, nutrition, and rest. Can you dive a little deeper into those areas?
Sure. So hydration means getting enough water in a person's diet, and that is essential for our immune system to repair and replace damaged cells, no matter what type of cell it is, muscle, tendon, ligament, or otherwise. Cells need water to run their internal engines that we call mitochondria, and to enable the body to bring in nutrients and get rid of waste products.
And if you have been listening to our podcast, you know what enough water is for your body weight, as we talked about it in strengthening our immune system. What do we need from our food or supplements to heal our backs?
Well, necessary vitamins and nutrients for tissue repair include vitamins C, D, several B vitamins, folate also. And then necessary minerals for repair would be calcium, iron, magnesium, zinc, to mention a few. So with damage of connective tissues like muscle, tendon, and ligament, one needs also adequate protein to ensure good healing.
Are there foods that decrease the back's ability to heal?
There are foods that contain ingredients that fight against normal cell health, such as unhealthy fats that are found in a lot of fried foods and burgers and such, French fries. Also ingredients that produce damaging excess of what we call free radicals should be avoided. And those kind of things would be found in junk food, especially packaged foods, smoked foods, fried foods, foods with lots of additives and preservatives.
Seems like the same advice for preventing most health issues. And why is rest important after a back injury?
When injuring a tendon or a muscle or ligament, the first 1 to 2 weeks are very important for laying down the architectural framework for the area that's being repaired. It's during that time that one should pay particular attention to pain, and really, in a way, let pain be their friend to tell them when to stop using the injured area and give it more time to rest. After about 2 weeks, one can begin to use the injured area in a gradually increasing manner as the pain allows. So this gradual increase in the use of the area is much better than a sudden increase as far as avoiding re-injuries.
So I wouldn't go back to doing the activity that caused the injury right away.
That's correct.
I know it sounds like a no-brainer, but we humans can be pretty determined sometimes, maybe on the edge of going overboard. I knew a wonderful man who loved to play basketball with his sons on the holidays, but as he got older, he found he could not play a hard game of ball for an entire hour without getting hurt, when he only did it 3 times a year.
That's a good example. Maybe he could anticipate the upcoming holiday and play ball at the gym regularly for a few weeks before the family game.
I know moving takes a lot of work, and some have injured their back during a move.
That's true. As I get older, I try to find ways to use my brain more than my brawn, but I did injure my back in my move to Springfield last year. I just had too much activity that I wasn't used to, all in a period of about 48 hours.
Then did you have to rest, hydrate, and take vitamins after that?
I sure did.
Did you remember to use your core and your vastus lateralis muscles?
You know, I did. I also remembered to get as close to the object as I could before lifting, and then to bend my knees and lift more with my legs, not just my back. I turned my body slowly by taking small steps so that the twisting would not stretch my ligaments and cause an injury. I was just unfortunately one that was doing too much in too short a period of time. Now, looking back on it, I wish I would have done some strengthening exercises for my back a few weeks before the move.
What strengthening exercises would you recommend?
I'm glad you asked. We have indeed included some diagrams for basic strengthening and flexibility exercises in the document on back pain that's on our website at compassionlink.org/hints4health.
Wow, just think. 10 minutes a day of stretching or strengthening before bedtime could help prevent chronic back pain by preventing an injury that could cause years of pain. And an added benefit is that stretching before bed is known to help you sleep better. Besides stretching and strengthening, I know posture is important. Many of us spend hours a day at a desk, which can cause neck and back issues. Could you speak into that for a moment, Dr. Kidman?
Sure. So having good support for your lower back is essential, whether that means buying a supportive chair or using a small pillow behind your lower back.
That small pillow could also be used on those long airplane trips or long road trips missionaries make, right?
Definitely. And then also your feet should touch the ground when you're sitting for a long time. That gives some more stability to your back.
Or you could buy something to place your feet upon that helps with your posture when seated. I was blessed to inherit one of those apparatuses that was left behind in my office. Thanks, Monica.
Yep, you should also be aware of your neck position when you're sitting at the computer or even if you're standing.
Oh, yes. I have the tendency to strain my neck forward. I have to be conscious of keeping my head directly over my shoulders when I'm sitting, but especially when I'm standing.
Yes. Now, did you know that both swimming and walking also help strengthen your back and prevent chronic pain?
Yes. Also, taking time to stretch and walk around, whether taking a break from sitting at a desk or from driving, helps not only your back, but also your blood pressure and your blood sugar. Check out the study by Dr. Diaz from Columbia University. He found that small amounts of walking spread throughout the day can significantly lower your risk of heart disease and other chronic illnesses. Although the studies vary on the frequency and length of time, everyone agrees that getting up and moving about is healthier than sitting for hours at a time. I remember when my grandfather was in his 90s, he would walk around every 30 minutes. He said it would keep him from getting too stiff. He probably didn't know it was also helping regulate his blood sugar and blood pressure. He ended up living just 6 months shy of his 100th birthday.
Now, I wouldn't mind living 100 years if I was able to maintain my health.
Well, just remember, those small things you do today are all adding up to help your body keep healthy for tomorrow. By the way, did you know that when you talk on the phone, you pace?
I do?
Yep. But that's actually a healthy habit. If you have lots of meetings throughout the day, you could consider having a meeting with someone while you walk.
Well, small increments of change can lead to a lot better health.
That is true. And that's all for today. We hope you are able to take some of these hints for health and apply them so you'll live a longer and healthier life.
Thanks for listening to Hints for Health today. Join us again in the future for this series of podcasts that will help you in your goal of optimum health. This series is created and produced by Compassion Link, an Assemblies of God World Missions International ministry. I'm your host, Neil Ruda. For more information, visit www.compassionlink.org/hints for health and follow us on social media. God bless you.